Hi everyone. Today we'll talk about erythritol and how it can affect our health, so if you're fan sweeteners, this is definitely worth checking out. A recent study conducted by the Cleveland Clinic has shown a link between the use of erythritol, one of the most popular sweeteners, and an increased risk of heart attack and stroke. The study, published in Nature Medicine, looked at data from 4,000 people in the US and Europe, and found that those with higher levels of erythritol in their blood were at a higher risk of heart attack, stroke, or even death. The researchers also discovered that in the presence of erythritol, platelets formed clots more easily, which is a worrying sign for those concerned about their cardiovascular health. Erythritol-containing products are often recommended to obese people with diabetes or metabolic syndrome as a way to control sugar and calorie intake, but the study's authors warn that we need to make sure that the foods we eat do not contribute to the development of cardiovascular diseases. Heart disease is the leading cause of death worldwide, and we need to take steps to prevent it. Animal studies have also shown that erythritol consumption is associated with more intense clot formation, adding to concerns about the safety of this popular sweetener. The fact that our body naturally produces small amounts of erythritol means that additional consumption can lead to accumulation in the body, making it even more important to monitor our intake of this substance. But what about the long-term effects of erythritol on our health? After conducting a small pilot study on humans, the researchers discovered that the consumption of beverages sweetened with the same amount of erythritol present in many processed foods led to a significant increase in the level of erythritol in their blood for over 2 days. The elevated levels exceeded the threshold that triggers the formation of blood clots, thereby causing concerns regarding the safety of this sweetener. According to the authors of the study, it is necessary to conduct long-term research on the safety and effects of artificial sweeteners, especially in individuals who are already at a higher risk of heart attacks and strokes. The study suggests a correlation rather than a causal relationship, hence highlighting the need for larger and extended studies. To sum up, the use of erythritol, one of the most popular sweeteners, has been linked to an increased risk of heart attack and stroke. As heart disease is the leading cause of death worldwide, we need to take steps to ensure that the foods we eat do not contribute to its development. While further research is needed to establish a definitive cause and effect relationship, it is clear that we need to monitor our intake of this substance and consider alternative sweeteners. That's all for today's episode. Don't forget to like and subscribe, and see you next time.